Vaginal rejuvenation shatters into four distinct clinical procedures once you look past the broad marketing terms typically used in consultation. Clinically, it acts as an umbrella label for a series of separate surgeries, rather than representing a single, universal medical technique. Booking a consultation based on this generalized phrase often means entering the operating room without a clear understanding of your specific anatomical needs. There is a recurring disconnect when patients expect a minor aesthetic adjustment but receive a recommendation for a complex internal structural repair. Pursuing a generic treatment path can lead to the financial and physical cost of a surgical recovery that fails to address your primary physical symptom. To evaluate surgical options accurately, we have to divide the genital structure into these four color-coded treatment zones. The deepest functional zone is the vaginal canal, shown here as the internal passage. The secondary structural zone consists of the inner labial folds, or the internal lips. Moving outward, we find the primary aesthetic zone, which is the outermost tissue structure labeled as the external lips. The final zone is the internal opening membrane, a localized gateway at the entrance of the passage. Matching a specific physical symptom directly to its corresponding zone allows a patient to bypass mismatched or unnecessarily invasive procedures. This comparison matrix highlights localized external-facing procedures, which are often performed under local anesthesia. Hymenoplasty is a procedure focused entirely on the physical restoration of the internal opening membrane. Choosing this procedure requires total abstinence from intercourse to maintain the repair, as the membrane is structurally broken upon the next penetration. Labiaplasty targets the internal lips, specifically reducing the size of the inner folds for increased comfort or aesthetic preference. The surgeon performs a wedge-shaped incision to remove the excess tissue before stitching the remaining edges together. Recovery involves absorbable stitches, a 1-month tissue healing timeline, and a mandatory 6-week pause on sexual intercourse. While these two surgeries address localized external concerns, they have no impact on the structural looseness found deeper within the canal. Vaginalplasty is a separate category of surgery that focuses exclusively on the internal passage itself. This is typically request wall and physically tighten the deep muscle structure to restore internal structural integrity. This deep tissue repair requires a higher physiological commitment, demanding the use of spinal or general anesthesia rather than local numbing. Vaginoplasty trades a more intense surgical impact and a longer recovery for a permanent structural tightening of the vaginal canal. For those seeking volume, fat grafting is a procedure limited strictly to the external lips. Fat is harvested from the abdomen or thighs and then injected to create a fuller, more youthful external appearance. This is an aesthetic enhancement only. It does not provide functional relief for tissue enlargement or internal looseness. It is possible to combine a vaginoplasty with a labioplasty in a single surgical session to address multiple zones at once. Consolidating these procedures merges the healing timelines, but increases the initial recovery burden and anesthesia requirements. Understanding the difference between a cosmetic injection and a deep tissue reconstruction is the only way to plan for the necessary lifestyle adjustments after surgery. This decision tree provides a framework for matching your specific physical symptom to the appropriate clinical pathway. If you are experiencing internal laxity following childbirth, the path leads to vaginoplasty for a deep functional repair. If the primary issue is physical discomfort or the size of the inner folds, the branch directs you toward a labiaplasty. For those focused on external aesthetic fullness, the pathway identifies fat grafting as the solution. Following this framework prevents you from undergoing an invasive procedure that fails to target the actual source of your discomfort. Regardless of the surgery chosen, there are post-op non-negotiables, including a mandatory 6-week ban on sexual intercourse. Strict daily hygiene is required to ensure that the tissue integrates safely around the absorbable stitches without infection. These temporary lifestyle restrictions are the required trade for achieving permanent structural or aesthetic changes. Moving away from the term vaginal rejuvenation allows you to prioritize precise anatomical targeting, ensuring your surgical choice matches your functional needs.